Hey everyone, welcome back to my channel. Sorry I've been away. I've been figuring some stuff out with my mental health. So as you know from my last video, I have been diagnosed with major depressive disorder and decided to take a little break from social media. As many of you probably know, depression is a common yet very serious mental illness that not only affects how a person feels, but how they think and how they act. So depression usually first presents itself as feelings of sadness or loss of interest in activities that were once enjoyed. After doing some of my own research and speaking to health professionals, I was fortunate to realize that depression is treatable. The two most common forms of treatment are drug therapy and psychotherapy. So my doctor had prescribed me a form of drug therapy called SSRIs, which I learned are pills that block the reabsorption of a chemical called serotonin in the brain to hopefully level out whatever chemical imbalance has been going on. I have been using these pills for just over a month now, but I don't think they're working for me. I was starting to have very scary suicidal thoughts, trouble sleeping at night, was always tired, and lost a bunch of weight. So I filmed a little bit of my journey over the past few weeks and wanted to give you guys a glimpse, so let's check it out. Alright, so I'm just on my way to my doctor's appointment. It's kind of gloomy out, a little windy, but it's starting to warm up. And yeah, we'll see what Dr. Ebuka has to say. Okay, so I just got to the doctor. This is my friend Folu. Hi. She decided to come with me, and hopefully Dr. Ebuka will allow us to film. Hi, Dr. Ebuka.
Hi.
How are you?
I'm good. How are you?
Nice to meet you. I brought my friend with me. Is it all right if she
yeah,
films?
absolutely.
Okay,
Absolutely.
awesome.
Hi. Take a seat. Okay. So why don't you start off by telling me some of the symptoms that you've been experiencing?
So I've just had a major depressive disorder.
Right.
A few weeks ago, I went to my doctor looking for an alternative to drug therapy, and they told me about cognitive behavioral therapy. If you've never heard about it before, like myself, Dr. Ebuka told me that CBT is a form of psychotherapy, meaning that it does not use drugs. It is prescribed for a multitude of mental illnesses, including depression, anxiety, schizophrenia, and bipolar disorder, just to name a few. This therapy is short-term, needing only 12 to 20 one-on-one sessions to see results. I didn't understand how a therapy of this duration was supposed to cure my depression, but I was told by my doctor that because this method is so patient-driven, I would be responsible for my own homework between sessions, such as recording my feelings. Dr. Ebuka explained that CBT is meant to help people like me identify distortions in my thoughts. Building a healthy relationship between my deepest thoughts and behaviors is the end goal of CBT, since this is a proactive rather than a reactive method. I asked Dr. Ebuka what they meant by proactive, and they explained that this therapy may not help with past trauma someone has endured, but rather helps them cope with the day-to-day struggles of dealing with their mental illness. Through teaching various coping mechanisms such as breathing exercises, CBT would hopefully be able to not only help me become mentally healthy, but also stay healthy after the therapy sessions have ended.
We'll see you guys. Okay.
Bye.
Bye.
Alright, so I just got home from my doctor's. I'm feeling pretty good, a little bit tired, so I think I'm gonna take a nap and just really take in what the doctor had to say. And when I wake up, I'm gonna conduct a little bit of my own research on CBT. Being diagnosed with a mild case of MDD, I knew there could be some variability in terms of what treatment options would be most effective for me. Should I resort to a new drug than what I had already been using? Citalopram, sertraline, vilazodone? Or should I just up my dosage? All of these antidepressants seem scary. I've also heard how quickly I could positively respond by using drug therapy. Drugs or CBT, what's my best option here? I finally stumbled upon a paper by Current Psychiatry, a peer-reviewed medical journal from the US. Some of these findings came to a shock for me, as they had studies showing that CBT would be best to treat mild conditions of MDD, while antidepressants could result in overtreatment. A combination of both treatment options was recommended for people experiencing moderate to severe symptoms, but I really don't want it to come to that. CBT it is. I really hope I find comfort and relieve some of these distorted thoughts I've been having lately. So I'm feeling quite hopeful about my journey with CBT, and I'm looking forward to starting these sessions and getting my symptoms in check. Remember, if you or anyone you know is suffering from a mental illness, reach out for help. And if you'd like to learn more about CBT, click the link in the description box and consult your doctor. I'll be updating you all soon.